everyone. What's going on, everyone? TikTok Live number 42 we're at now. It's December 8th, about 8 o'clock, 7:45 at night here, Sunday. Just sign into the TikTok Live number 42. The top 3 listeners, I give you guys a shout out in the caption of the podcast that I'll post later to YouTube. I'll post it on podcast platforms. All right, let's go. First comment here was from saying, hi, doctor. Hi-yo. Cali Girl 73 said, Merry Xmas. Merry Christmas, Cali Girl. Merry Christmas. Happy holidays, everyone that's on. Justin Y721 said, is med school worth it? Well, Justin, it's a great question. And with the rising costs of everything, the increased debt that all these students have coming out of school, the education, how expensive it is, the loans, and then over time, to get out and actually practice as a doctor now, it takes forever. I mean, you're literally getting out at like 35, 40 years old before you actually can start practicing and now start to pay back some of those loans, some of that debt. So your career is going to be at a maximum of like 30 years, give or take. The reimbursement has only been going down in healthcare for the most part, not 100%, but reimbursement for treatment that's done on patients, whether it's surgery, whether it be this or that, it's been going down over years. And we see a lot in dentistry as well. That's not good. That's not good. So is med school worth it? It is worth it if you know exactly what you want to do and you're going to be excited doing it every single day you go into work, all right? Riley followed the live creator. Thanks, Riley. Thanks, friend. Brendan Elliott joined. What's up, friends? Swole Air said, what's the top things you do as an OMFS? So in oral maxillofacial surgery, we do everything from wisdom tooth extractions under IV sedation, where we put people to sleep in a light sleep where they're breathing on their own, right? We do everything from all the way up to trauma, maxillofacial trauma, as jaw fractures, like a ZMC fracture, that's the cheekbone, and more around the eye and the nose. We also do orthognathic surgery. Orthognathic surgery is where we cut the top jaws and the lower jaws. Generally, this is based, I'm giving you a general outlook on it, and then we move it forward, backwards, up, down. We can adjust the cant, the tilt if we need to, and so on and so forth in order to match the generally agreed upon and accepted facial proportions based on cosmetics and aesthetics and as well as function in order to make sure that the dentition comes together naturally. So there's a array of surgeries that we do. We also sometimes do cancer if certain oral surgeons go onto a head and neck fellowship, for example, taking malignant cancer out of the face, the mouth, the tongue, the neck. CaliGirl73 said, heard of a man who had been denied obturator through insurance. Have you seen this? Yep, we've seen it. Yes, we have. Corey, what brand of loupes and magnification do you use? Actually, I don't use loupes right now. I use blank loupes, and I got them from Designs for Vision. I use it because for eye protection, but then also I get a little light in the front here and you just wave your hand above and it turns on. It's got like 2 powers. It's pretty sweet. So that's what I use day in, day out. I don't like to use loupes. I think it makes you kind of magnify on the micro scale. I want to have a full view of the field. I want to have a full view of the tooth. I want to see the airway. I want to see the patient, how they're reacting under IV sedation, for example. So honing in with loupes, I just feel like it just gets in the way of what I'm trying to do. I don't know what flag that said, but they said, can I get into dental school with a 3.3 GPA? I have heard of that being done. I have, yes. Yeetskirt06 said, wife has been a hygienist for 15 years. She knows more than some of the DDS she works with. Cool. Holly Hart said, my dream is to become a surgeon. Do it. Go to school, work hard. You got this, Holly. Get after it. It's a lot of perseverance. It's a lot of sacrifice. Don't underestimate the number of years you need to sacrifice and buckle down in order to get there. It's doable, but you got to be serious about that. Schlatt Gotti said, can you show us your desk streaming setup? Let's see. My little, sure. Here we go. This is my little desk streaming setup right here. This little spot right here. And then this way you can see in the background, you got the Empire State Building up there. To the window, you got my my little dresser here with my Christmas light setup. It's adorable, right? But I don't know. I'm not like extravagant or anything. This is it. This is what I got. So there you go. Yeetskirt, I am an MD. She refuses to go for DDS, according to her, because it is a hassle. It would be a hassle to go back from hygiene school to dental school. But yeah, dude, it's doable. Kimby said, at Yeetskirt06, I'm a retired hygienist, and I agree. Do it. Go back to school then, Taylor Alexander, share the live. Thank you, Taylor Alexander. Tiana said, Mr. Gallagher. Tiana has been active. You may invite them. Heath said, who is the coolest orthodontist you know? Heath is Heather. She was my dental school partner in clinic for the 3rd and 4th years. That's really funny that she's on the live right now. Let's shout out to Heather Ercolano. She's an orthodontist. I think you're moving. Did you move to Florida yet? Or because I knew you from out. We went to dental school out on Long Island at Stony Brook, and she's from Long Island in the Stony Brook area. But I heard that you were moving that to Florida. Is that right? Also, I know a couple orthodontists. So Heather graduated from Stony Brook Ortho. My buddy Sean Czar, shout out to Sean Czar, and Eitan Zarabi, a whole bunch of orthodontists that I know. Tiana said, woohoo. Andre Safer said, hey, I've been very anxious about taking the DAT because I never feel ready. Any advice? Yeah, you got to go for it. What do you do when you're like going to jump in the pool? You just got to go for it, you know? Miriam said, yo, Yeet Skirt said, at Kimby's, she is so incredibly intelligent. And she says, bring a general practitioner. DDS isn't worth it. I don't know, guys. I don't know, friends. Lake Tahoe said, do you like Trisha Paytas? I don't know who that is. GM said, I have a CL1 practical 19 and 30 tomorrow. Good luck. Good luck, GM. You got this. You got this. Make sure you get there early, get your nice setup in, get in a groove, get a good playlist on in the headphones beforehand. That's always good. Tiana said, Dr. Gallagher, asterisk. It's okay. Miriam said, wow, you can extract cancer. We resect. Yeah, I helped out on several cancer cases of the head and neck region, the tongue, the maxilla, the mandible, the gingiva, the bulky mucosa, the lip. Yeah, we've done a bunch of these with the attendings that we have over here at in the residency. Yeah, we do. User 81827. Have you ever seen necrotizing fasciitis? Yes, I've seen necrotizing fasciitis. It smells bad too. Tiana said, user 81827. Oh my God, I know someone who has this. Q, opinion about orthodontics. It's a very clean specialty within dentistry. A lot of my good friends are in orthodontics, and I think it's a great idea. Very clean lifestyle, great quality of life. But I think you want to make sure you have a game plan when you go into it, right? Because I know an orthodontist who works Monday through Friday at literally 5 different offices. So it can be difficult. I also have a friend who's an orthodontist. He just bought this last year. He just bought his practice his second year out of residency. So it's also doable from that standpoint, right? But he's also only working there twice a week because it takes some time to build a reputation, pick up some steam with the orthodontics practice, okay? That's with any dental office that you start from the bottom up, you know? Yeet Skirt 06 said, we both work with the best MF surgeon and has MD as well, and he hates sending anything to insurance. Yeah, dude, insurance sucks. Insurance, it is not what it was designed to be. And I got some ideas about that in the future. I think I want to start an insurance company within the next 5 years, get that going, and just use artificial intelligence to have an algorithm where you can base off of reimbursement rates and like the average reimbursement rate per geographic area, as well as track it with the market. So when things go up, it goes up. When it goes down, reimbursement rates goes down. And it's not going to be cheaper necessarily from current dental insurance, but it's going to be more widely accepted because it'll get you more treatment paid for, and it'll reimburse better, less denials than that. Anyway, let's continue. Yeet Skirt followed the live creator. Thanks, Yeet Skirt. Regina said, what are some do's and don'ts when someone is shadowing you? Great question. Do's and don'ts. I mean, it's always like be there to be very respectful, be very quiet, refer to the attending or, person as a doctor if they are a doctor. This is just stuff that I was told there. Just and be very mindful of patients because technically, you're there witnessing their care get done. So you want to be respectful of them. And if they don't feel comfortable with you being in the room, you step out of the room, right? Simple stuff, I think. Shirley shared the live. Thanks, Shirley. He said, yes, working in the beautiful Boca Raton. Wow. Boca Raton is awesome. Florida is beautiful. We might be down there one day. We might be seeing you down there someday, Heath. We'll see. Yeet Skirt 6, I am double board certified neurosurgeon and cardiologist. Holy moly. So naturally, neurosurgeon and cardiologist, I mean, do you do both of those specialties day in, day out? I'm curious. And also, no wonder, I would be encouraging your wife to go back to dental school too. It also depends. I mean, if you're a neurosurgeon and cardiologist, you've just completed 7 to 10 years of maybe even more of residency training, maybe even fellowship training. That's a lot. Webb C. Garrett, tips for general DAT studying. General DAT studying, I mean, you got to get all the resources. I've mentioned this on other podcasts, but the biggest thing is going to be being consistent with your routine, continue to exercise, continue to diet accordingly, and make sure you're getting enough nutrition and sleep. But basically, you just got to go hard. Just got to go hard. And I think Quizlet is a tremendous resource for studying for the DAT. 0.0527 said, are you familiar with Diamond braces. I'm not familiar with those. No. GM said, are you at Columbia OMFS? Nope, I'm not at Columbia OMFS. Yeet Scuddo 6 said, she says you do no work. It's your assistants and hygienists that do the work. Maybe for general dentistry, I don't think so, because what about when you're doing certain treatments as far as, fillings, crowns, preps, seating, like certain denture work and stuff. So there's a part of it that hygienists and assistants do, but an assistant isn't going to do a crown prep. A hygienist isn't going to do a filling, from my understanding. Big Dave Lee, thoughts on doing a GPR? Well, it depends on what you want to go into. If you want to go into oral surgery, sure, you could do a GPR. I would use that time to study for the CBSE then, for example. Jefferson S. Raskin, hey, doc, nice new mic. No, it's not new. It's not new. It's the same one. Tiana said, like the live guys. Bird06 said, look up Dr. Michael Will in Maryland, brother. I'll check him out. Dr. Michael Will. Is that you? Are you in Maryland? Very nice. Jesse, are you Skibbity Baka? What is that? Faith Fox said, should my kid's dentist know that he had Kawasaki disease? Yeah, there are oral manifestations of Kawasaki disease, right? So potentially should they know? Make sure you disclose all medical history to your dentist, your doctor, your providers. Yeah. Tiana, follow the live creator. Thanks, Tiana. Websy Garrett, did you use any Anki when you studied for the DAT? I'm assuming you use it in dental school. I used it very minimally, not as much as I would have liked to in dental school. I was a big Quizlet studier. Big for Quizlet, right? I used to, actually I still have it of Quizlet. I have the premium version, so you could put figures on the index cards, and I like to make the index cards like question, answer, and just get repetitions from there. Yeah. Yeetskirt said, yes, I practice both in the head and you head both departments? Wow. I am confused. Your background seems to be TikTok. No, this is my actual, see, there's a real plant. Okay. Yeah, this is my little background, my cute little area behind me. That's some IKEA. That's it's all about the setting. Penny said, are you married? I'm not married, Penny. Tiana said, friend has cracks in his teeth and now he's hesitant to go to a dentist. Lack of trust. Suggestion. Yeah, my suggestion would be use Google reviews. Google the local dentist in your area. You could go to another one, get a second opinion, get a consultation somewhere else. I would separate the dentists in your local area by the top reviews. Like, look up the top 5, narrow it down to 1 or 2, and try them out. See what you think. Look on their social media. See what kind of stuff they're putting out there. See what kind of content. So you could kind of meet them before you go to visit them, right? That's part of a reason why I like to make social media, because, with patients and social media these days, you not only go to their website and stuff, look at and read all the reviews. It's like buying from Amazon. Before you buy it, you're looking at what the reviews are like, right? What's the average rating? How many were bought that month? Do the same thing with the dentist when you're finding them. Look at them online. Look at their social media page. And it's kind of like a pre-consultation. You could get an idea of who they are before you go to them, all right? John Watts, resent because you skipped mine. What did I skip? Officer Angela. Hey, what's up, Officer Angela? Aaron said, Daddy. Do you have the matter, Daddy? Do you know that joke? Tiana said, at John Watts, resend it. Aaron said, I have AIDS. Lisa T said, do some OMFS programs only take kids from their dental school or non-cats? I imagine so. Very rarely. Programs are generally open to getting good applicants no matter what their history was, their background, where they came from. Aaron just got the number 1. Gift your badge, nice. Yeetskirt says Dr. Will has more letters after his name than anyone you know. I'll have to check that out. I'm going to have to check out Dr. Will. Aaron said, I love you. Aaron said, 3 roses. Aaron said, Papa. User 62427, same. Love Quizlet. Yep. Quizlet is excellent. Lauren said, Brendan, I'm currently using the tips you gave me to structure my personal statement. Thank you. You got it, Lauren. Good stuff. Lauren, you were in the top 3 of the last, if I remember correctly, it was either the last TikTok Live, number 41, or the week before that, 40. So congrats. I gave you the shout out in the caption, by the way. John Watts, you skipped mine again. I don't see. Nope. I'm scrolling through it, and there was nothing from John Watts in between. Lisa T, if I take my CBSE D1 year, it will be valid by the time I apply to OMFS programs. Yes, Lisa, if you take it, it will be valid when you apply. You have 6 tries to take it. Yeah, I would take it, but expect to take it again, especially early D1 year. Good luck. You can do it, but expect to take it probably more than once, maybe 3 times. Jefferson S. Raskin, can you describe the differences, benefits, and application of zygomatic implants versus root form? Zygomatic implants, like the differences, benefits versus root form. So zygomatic implants, they're huge. They're like this big, and they go back into the zygoma, and then they have a little stand in here that the dentures latch onto. Versus root form, the root is just, you mean like dental, like regular dental implants? I need you to describe that a little better for me. Lisa T, do CBSE scores expire if they're taken too early? No. They expire over time. You have plenty of time. It's like you got years before that happens. Caroline, did you have to make up the days you were out of school to attend OMFS interviews? No, I didn't. I scheduled on, actually, no, we were remote at that time. So no, it all worked out. A Webb C. Garrett, what do you think about dental schools with med school curriculum in terms of prepping for the CBSE? Yeah, they generally help you because you're taking med school exams, and that's what the CBSE exam, right? It's a modified, shortened step 1 exam, which is the first board exam for medical school. Yeah, so having a med school curriculum combined in your dental school helps. It does. It's not the end of the world if you don't, but it helps. Day Goo 90. Hey, Brendan, I have a small gap on my anterior mandibular teeth. Do you recommend braces or Invisalign? I would recommend seeing an orthodontist to make that decision for you. Everyone's going to have a different opinion on that, right? And it'll probably be a personal recommendation by that orthodontist, but I'm sure they'll give you a good recommendation. Penny said, how old are you? I'm 30 years old, halfway there to 31. Sam the Ham said, hey, can you tell your med school to send me an interview, please, and thank you? That's good, Sam. That's good. Lisa T, can you explain the CBSE score range and what's a good score nowadays? I've seen anywhere from the 20s and 30s up to 99. What's a good score nowadays? I would still put it above a 70, 75. If you get just below a 70, that doesn't count you out. That's not a bad score necessarily. You can still apply with that, but generally you want to train for like that 70, 75 plus. Jesse said, do you know what skibbity means? I have no idea what that means. Jefferson S. Raskin said, zygomatic versus regular implants. Would you use zygomatic over regular implants? It really depends on how much bone you have in the maxilla. That's what it comes down to. If you're going to put an implant out to the zygoma, that means you don't have enough space in your maxilla to put the denture in there, right? So therefore, what I'm saying, like it's more of like it's like a backup. Plan A, dental implants here. Plan B, maybe all on X, where you have some posteriorly angled implants with some multi-unit abutments. Plan C, if you have no bone in the maxilla, yeah, then you might have to go with the option of getting zygomatic implants versus an IPS. That's like a plate that latches on to the maxilla and out to the zygomas. Okay, Jefferson, a few more questions, then I'm going to pack it in, guys. Got to go eat dinner. Jefferson S. Raskin said that Yeet Skirt 06 said MD, DDS, facts. Yeah, that's actually a common thing of oral surgeons to have. John Watts, I'm waiting to hear back from dental schools this cycle. Any tips to keep my mind off it? Yeah, if you're in college, study, exercise. If you're out of college, work more. Oh, that's what I did when I was waiting. Yeet 06 said, you are 30 and a DDS. I am 6 years older and had both my departments. Get back to books, brother. Yeah, I'm going to head back. I just spent all day. I got a presentation tomorrow. I put together the questions and stuff for a morning conference. I got another presentation on Thursday. We're busy over here, friend. So you're only 36. That's excellent. You're really young, and you head the departments. That's incredible. Congrats right there. Y and L Moomy said, what is a good step 2 score? I'm not sure. I don't take the step 2. I'm not familiar with scores on that. I think just passing would be good. Lisa T, any tips on staying on top of your class in dental school rank-wise? Yeah, keep your daily routine, exercising, sleep, eating right. It's going to come down to studying. Make sure that you have a good morning routine to study and a good afternoon-night routine of studying. That's really it. Just be on top of all your classes, right? All right, guys. That's it. I'm signing off. Thanks for coming on. The top 3 listeners to this TikTok live, which is number 42 on my podcast. I'll be putting it on YouTube podcast. The top 3 listeners, I'll be giving you guys a shout out afterwards. Last question. Kenzie Distich, do you have a job lined up after residency? I do. I signed back in July. I'll be out in Melville on Long Island working with all county oral surgery with Dr. Ross Chavkin, who's the owner of the multi-practice. All right, friends, wish you a great week. Happy holidays. They're coming up soon. It's December 8th right now, Sunday. So wishing you guys a great week ahead. Thanks for coming on. I'll be posting this hopefully tonight, maybe tomorrow. And have a great night. All right, friends.